Dr. McCormick, should we screen the patient for severe sepsis, then order a lactating chemistries?
Yes.
Stephanie, please bolus a liter of normal saline. I will call the ICU triage physician. And Robert, will you go to the nurse's station and get a copy of the severe sepsis order set?
Yes, I'll get the severe sepsis order set.
Screen for sepsis. Sarah has screened positive for severe sepsis. She has a documented infection on antibiotics, meets all 4 of the SIRS criteria, and has new organ dysfunction, systolic pressures below 90. Her urine culture has grown E. coli, but we don't have the sensitivity back yet. She's currently on Cipro. I think we should add ceftriaxone.
Oh, Marie, you mentioned a fluid bolus. Should I start that?
Yes, thank you, Stephanie. Let's give Sarah Johnson a liter of normal saline to infuse over 20 minutes. Dr. McCormick, did you want to order ceftriaxone 1 gram IV every 24 hours?
Yes.
Stephanie, please make sure that ceftriaxone is hung within the hour.
It's ceftriaxone hung within the hour.
I ordered a chemistry panel and a lactate, and yes, I'll order the ceftriaxone 1 gram IV every 24 hours, and once we get the sensitivity back, we can adjust our antibiotics.
I will facilitate her getting a bed and step down. Dr. McCormick, if you could put in the transfer orders and be sure to include the sepsis protocol.
That sounds good. I'll put in the transfer orders with the sepsis protocol.
Marie, Dr. McCormick, I need clarity.
Okay, Stephanie, what's going on?
I think that Sarah needs closer monitoring. I'm concerned that her BP is dropping too quickly, she's not responding to treatment, and she won't be monitored closely enough and step down. I would feel more comfortable moving her to an area with higher monitoring.
Actually, you're right about her blood pressure and her unresponsiveness to antibiotic and fluid therapy thus far. I agree. I feel comfortable moving her to the ICU. Dr. McCormick, what do you think?
I agree with Stephanie. I think it's a good idea.
I feel much better about that. And you'll come back to check on her?
Well, either Marie or I will.
So let's review the plan. I will facilitate her getting a bed in the ICU. Dr. McCormick, if you could put in the transfer orders and be sure to include ceftriaxone 1 gram IV every 24 hours and ciprofloxacin 400 milligrams every 12 hours.
Mm-hmm. That's ceftriaxone 1 gram IV every 24 hours and Cipro 400 milligram IV every 12 hours.
Robert, can you make sure we have oxygen and emergency equipment available for transport to the ICU?
Yes, that's oxygen for transport and emergency equipment.